Receptors called maculae have sensory hair cells that are covered by a gel cap with tiny crystals. These are triggered to fire nerve impulses whenever the head is tilted. These maculae are located inside tiny sacs called the utricle and saccule, which are found in between the canals and the cochlea. An organ known as the cochlea is found in the ear and is the reason hearing is one of the five senses. The cochlea transmits nerve impulses to the brain to interpret sounds. The outer ear consists of two main parts. The first one is the auricle, which is cartilage covered by skin placed on opposite sides of the head that also possesses many creases and folds. The second is the auditory canal, which is the canal that sound travels through to the eardrum to begin the process of making its way to the brain. The middle ear contains the eardrum, which is also known as the tympanic membrane and transmits messages from the outside world. Also, the middle ear contains the ossicles, which are three tiny bones, all attached. These are the malleus or hammer, the incus or anvil, and the stapes or stirrup. The hammer bone is a long handle attached to the eardrum. The anvil is the bridge bone between the malleus and the stapes. The stapes is the footplate and is also the smallest bone in the body. The inner ear contains the oval window, semicircular ducts, cochlea, and auditory tube. The main purpose of the oval window is to connect the middle ear with the inner ear. The semicircular ducts are attached to the cochlea and nerves and are fluid-filled canals that send information on balance and head position to the brain. The cochlea is a spiral-shaped organ of hearing, which transforms sound into signals that get sent to the brain. The auditory tube drains fluid from the middle ear into the throat behind the nose. Tinnitus can be described as a roaring in the ears or also a ringing, clicking, hissing, or buzzing. Main causes include exposure to loud noises, ear and sinus infections, brain tumors or thyroid problems, and heart or blood vessel problems. Possible treatments for this disease include hearing aids, sound masking devices, and medicines. Meniere's disease is a disorder of the inner ear which causes severe dizziness and tinnitus. It can cause temporary hearing loss with air pressure or pain, and as of now, there is no cure. Ear barotrauma is injury to the body because of air or water pressure. A change in altitude is the most common cause because it often occurs on airplanes, mountains, or scuba diving. Treatments often include chewing gum or yawning if it is mild, but also decongestion medicines work. Ear infections, or otitis media, are the most common of all ear problems and tend to be more common in children. Ear infections affect the middle ear because the tubes inside the ears become clogged with fluid and mucus and affects hearing because sound cannot easily enter. Ear infections often go away by themselves, and if they occur too often, it is recommended to receive either surgery or tubes. Here are some symptoms of ear infections.